you are not necessarily competing with the federal exchange. What you're doing is offering a different way for people to sign up for health insurance as long as they don't need a subsidy. Is that correct?
Today, that's right. You know, we've been doing this long before the words exchange and health insurance were in the same sentence. We're simply an option. And at some point soon, when the technology is stable, we expect that when healthcare.gov's technology is stable, we expect that subsidy-eligible individuals would be able to use us as well.
So you're saying that healthcare.gov still isn't stable?
Well, it's not quite where I think they want it to be or it needs to be. We work very closely with it. But the good thing is that we've got support from the federal government to be able to start to work with subsidy-eligible people. We just need their technology to be able to connect to ours. And I'm anxious for that to happen because when that does, we can help to get more people enrolled, just like we did in this last quarter where we had so many young people come in, which is the demographic everybody wants.
Gary, I want to bring the panel in on this, but guys, it would seem to me, if I'm the Obama administration and I see a way of getting younger people to sign up, wouldn't I want to take advantage of that? Is there any reason why they shouldn't pursue this?
Possibly the technology of it. I mean, just and I think Gary can speak to that. I think that's been part of the issue is, as you just said, the systems aren't talking to one another. But it'll be interesting to see if those numbers line up after a while. If the Obamacare exchanges start to sign up those young invincibles that weren't signing up initially, and the numbers start to match up with e-health.
But isn't the case that what we're seeing now is that no matter how you look at health insurance, there's no cheap date. There's no way to, other than the catastrophic, there is no way to go out on a Saturday night with a health care policy and not spend a lot of money.
What I really want to know is and I have to ask this question, Gary, and that's when my daughter signed up just a few months ago under the Affordable Care Act, she didn't know that your exchange existed. She was stuck going to this one exchange, and I don't know if yours makes a difference, where she gets no out-of-network coverage, just what she was offered under the Affordable Health Care Act. Does your exchange do anything differently in the programs offered there?
Well, we can, because we, in some cases, have got many more products than the government exchange has, all of which are compliant with Obamacare. The message I have to your daughter and everybody else is, just go online and see what choices there are. And by the way, the reason we attract so many young people, and this isn't new, we've done it for a long time, is that we do everything online. Young people don't want to pick up the phone. Young people don't necessarily want to use some kind of a government site. It's fine that they do. But they want to do this in their hand phones. They want to do it on their tablets, and that's what we do. And that's why we need, I think, entities like ours partnered very closely with the government to make this legislation work.
Gary, I'm just curious, is the selection of plans offered, I mean, you must do comparisons, so how does the selection on your site stack up to healthcare.gov? Well,
what healthcare.gov has is our subsidy-eligible plans. Right. We will have subsidy-eligible plans, other plans that are not subsidy-eligible but are compliant with Obamacare. And so for many people, that may be a better option because there's a wider network or choice of doctors, hospitals, things of that nature. Once again, this is something that I just urge people to investigate and learn a little bit about before they go ahead and simply make a decision.